Hi, Mary. Thanks for coming in today. I wanted to talk to you about breast cancer screening since you're now 40 years old. The United States Preventative Task Force recommends biannual screening mammography for women from ages 50 to 74. But the American Cancer Society states that women should have a chance to start screening at the age of 40, which you are now. Um, and that's just a recommendation for you to decide and me to work with you if it's needed at this time. They do want you to start at 45 over 50, though. The United States Preventative Task Force also states that screening can start before 50 on a case by case basis. And so this is my opportunity to work with you and decide what's best for you because every person is going to be different. They call this a grade C recommendation, which simply means it allows for us to look at you as an individual and not just as a number, which is what I like to do. Both organizations agree that mammograms prior to age 40 are not recommended for healthy women, so we haven't had to have this discussion yet. We do not do it routinely at younger ages because there is an exposure to radiation because it is an X-ray, and radiation over time can build up and cause a cancer risk, so we don't want to do it too soon. Especially if there's not a high incidence of getting cancer at those younger ages, unless there's some other issues going on, which we don't have with you. The amount of radiation is minimal, but it can detect areas of concern before they can be felt before the exam that we do at your annual testing or your annual exam, or even if you're doing the breast exams at home. This can show us if there's something there before we could feel it. There is a possibility that it could show us something that is not cancerous. But because we're finding something, then we would need to do an ultrasound and possibly a needle biopsy to test to see if it is cancerous or not. And having a positive result can cause a lot of anxiety. So that's one of the risks we just need to be aware of. But know that if there is a positive result, we're going to work quickly to get testing done and get you some answers. And if needed, get you treatment. Hopefully, they wouldn't be anything at all. It is not conclusive that you would have cancer off of one mammogram. I just want to make sure that we're clear on that one. According to the National Cancer Institute, it is possible for a mammogram to miss about 20% of breast cancers, but because of the availability to take x-rays very quickly and get them read, it remains the best initial tool that we have for testing. And overall, mammograms reduce the number of deaths from breast cancer by about 15%, which is really significant. The 15% is for age ranges 39 to 59, and it allows for early treatment. But the United States Task Force shows that ages 40 to 49 have a better benefit, and even more so at 50 to 74. So your risk of breast cancer increases with age. Therefore, the mammogram necessity becomes more prevalent the older you are. The most benefit is actually seen in women's ages to 60, 69. So overall, what does this mean for you? You are healthy. You have no risk factors for other disease. You don't smoke. From our exams, I would place you at a low risk. I do not feel that you need to start mammograms now. But if you have strong feelings and you've been, waiting for this opportunity to come and you would really like to have one, then it's absolutely your right to take your healthcare in your own hands. And I will support you in that. Because of your lower risks, if you had a negative one, I would recommend that we don't have another one till 45. You would not need to start them yearly unless we had some sort of abnormality that we wanted to keep an eye on. As we do not know your genetic history, another path we could go for you at this time is to see a genetic counselor. They can help you calculate your personal genetic risk for the disease. Now, genetic doesn't mean you're going to get it, doesn't mean you're not going to get it, but it is another tool just to give us some more information about you as an individual and not the statistics of Americans or people with breast cancer overall. And it might help us to determine when we want to start your mammograms, if we want to start them early or if we feel comfortable starting them a little bit later. Things that you can do just to keep your risk low. Do regular exercise. The American Cancer Society recommends 75 to 150 minutes a week, spaced out throughout the week. You don't have to do it all at once. This will also help keep your weight at a healthy level, which reduces your risk. Keeping alcoholic drinks to a minimum, they say about one a day. Increase your intake of fruits, vegetables, fish, chicken, low-fat dairy, all the things that are constituted of a healthy diet, along with keeping up with your routine exams, which you already do because you're already here. So I want you to think about it. You have opportunity to ask me questions, and I'm here for you. So let me know what you'd like to do. My recommendation is right now that we don't do a mammogram, but I'm happy to recommend you to a genetic counselor or order one if it's going to help keep your mind at ease. So just let me know what you want to do, okay?